Okay. Hi, everyone. Thank you all for coming tonight. So this webinar was put together by the Diversity Special Interest Group and the Diversity, Equity, and Inclusion Committee subcommittee at the AMSSM, and with the help of Andy Meyer. So we have a bunch of great panelists today who we're going to introduce. I'll just start by introducing myself. I'm Lauren Prisco. I'm the AMSSM Medical Student Interest Group President. I'm a third-year medical student at Weill Cornell. And now, I guess, for each panelist, maybe you can give your name, your primary specialty, your location, and your practice type, and just take a couple minutes to introduce yourself. So maybe we can start off with Dr. Stafford.
Good evening, everyone. Thanks for joining us this evening. As Lauren said, I'm Cleo Stafford. Currently practicing in Atlanta, Georgia, with Emory Healthcare and Grady Memorial Hospital. So my practice is academic and also serving the underserved medical community as well. And my primary specialty is physical medicine and rehabilitation.
Thanks, Dr. Stafford. And the other co-moderator, Dr. Franck, is on as well. So maybe you can introduce yourself.
Hey, everyone. This is Dr. Franck. Sorry, I was getting feedback because I'm trying to monitor the chat as all, but hey, thanks for joining us. This is Dr. Franck. Love to have this group, love to see what we're doing, but my primary specialty is family medicine. I'm down here in Miami, Florida at Memorial Sports Medicine and Orthopedics. My primary specialty was family medicine, and my current practice is for Lee Orthopedics.
Awesome. And now Dr. Monique Burton, yeah, there you are.
Hi, welcome everyone. So glad that you can join us. My name is Monique Burton. I'm a pediatric sports medicine physician. So I did my residency in pediatrics and my fellowship in sports medicine. I'm in Seattle, Washington at Seattle Children's Hospital, and in particular at Odessa Brown Children's Clinic, which is our only continuity or community clinic in our Seattle Children's. And I think that was all. So my practice is made up of basically pediatric aged population up through 21. I'm going to pass it on. Is that okay? And so then I'm going to pass it on to one of my co-fellows, and that is Sam Dixit.
Hey, good evening, everybody. My name is Sam Dixit, as Dr. Burton said. I've known Dr. Burton for a very long time, believe it or not. I know she still looks like the day she graduated fellowship, but I don't. I'm in New York City at the Hospital for Special Surgery, and I'm primarily in an academic sports medicine position. I do primarily non-operative orthopedics. Are we passing it on? I can pass it on to Dr. Coleman.
Hi, I'm Nailah Coleman. I'm a pediatrician at Children's National in Washington, D.C. I did my residency in pediatrics, and then after a few years, decided to do sports medicine. I did my fellowship in a family medicine sports program with adult people in Georgia. And now I am back doing a combination of general pediatrics and sports medicine in an academic health center at Children's. Oh, and next, I'll send it to Rosemary.
Hi, Rosemary Gastini. I did a family practice residency. Actually, I trained in a 6-year BSMD program in New York City. Then I did a family practice residency, took a year off. Then I did a primary care sports medicine fellowship at Cleveland Clinic in 1985. And now I'm part-time. I do musculoskeletal medicine, sports, concussion, and the very honored person to have the medical student community outreach program, and just reviewed some of the grants. So pretty excited about some fabulous submissions. George, you want to say hi? Yeah, say hi.
Hi, everybody. This is George Brooks. I'm not a physician, I'm a professor, but I'm here with Rosemary on spring break. Hi, all.
Okay, and maybe Dr. Whitley can introduce himself.
Hey, everybody. My name is Jeremy Whitley. I'm actually one of Cleo Stafford's partners here at Emory in Atlanta. My primary specialty is emergency medicine. Then I did sports fellowship thereafter and have a kind of hybrid practice, 70% of which is kind of a traditional non-operative orthopedic setting. But I still do around 3 or 4 ER shifts a month to keep my skills sharp and current. Do a lot with the Georgia Tech athletic department as well as the Atlanta Falcons. So nice to meet everybody.
And our last panelist, Dr. Rosario-Concepcion.
All right, good evening, everybody. So I'm from Puerto Rico. So I did my medical school and PM&R in Puerto Rico, University of Puerto Rico. And then I did my sports medicine fellowship under family medicine in Mayo Clinic in Jacksonville. My main practice, I'm still working at Mayo Clinic in Jacksonville. I have multiple hats. I do non-surgical orthopedics. I do PM&R MSK, a lot of ultrasound. And as a very interesting kind of interest that I have, I do cancer rehabilitation also. So I see a lot of breast cancer in my practice, and I try to help them with the MSK complaints that they develop in their practice.
Okay, so we have a very accomplished panel. And it looks like for the next like 35 minutes, 45 minutes, we're just going to do a kind of Q&A style. So we have some questions prepared that I'm going to direct towards the panelists. And then in the last like 10 minutes, we'll just have a Q&A. So we'll be monitoring the chat so you can throw some questions in there as you think of them. So for the first question, this one is for Doctors Coleman, Franck, and Dr. Dixit. The first question is, why did you choose to become a sports medicine physician?
So I'll start us off. One of the things that made me choose sports medicine was basically exposure or lack thereof. Growing up, I played sports. I think we all who've gone into sports medicine played some sports at some time in our tenure. And basically, I was like, I have never been exposed to almost any physician of color growing up. And being in sports, I was always on the sideline. And, you know, you have a team doc. You're like, okay, whatever. You tell them something so you can get back into the game. But there was no connection. And as I went through medical school, I was exposed to different sports medicine physicians, probably in maybe my 3rd, 4th year. And I was like, oh, that's actually really cool. It combined sports, medicine, and gave me the opportunity to be that person that I was lacking on the sideline. And one of the things that I like to do is mentor. So it puts me in that arena around young, impressionables, athletes who you can direct in the right direction, whether it's getting them back on the field to achieve their goal of that, or I mentor a lot of the former athletes who I have at least 5 of them who've gone to medical school after that or gone to other professional schools. And so that helped me gear myself into sports medicine and that exposure.
I actually had a similar lack of exposure to sports medicine. I also was an athlete. I was the kind of person who wouldn't look at the Olympics, and I still do this, although my choices are much more limited, but they would look at the Olympics and say, what do I want to do of what they're doing? And that was like what I did. And I actually would do some of those things, but obviously now I'm limited to like curling and maybe like riflery or something. But I did a lot of sports and I never really got hurt. So I never really encountered anybody who did sports medicine, and I wanted to be a pediatrician. So I never thought that that was something I could do. Looking back, I did have an interest in the care of athletes. Whenever my parents were watching some random football game and someone got hurt, I would stop what I was doing because I wasn't watching, and then I would turn and watch the game and watch what they did. I see all these people come out and hover over this athlete, and I was like, oh, this is really cool. And then they'd wheel them off and the game would resume, and I would be like, oh, well, okay. And I just go back to whatever else I was doing. So I always had an interest in covering events, but I just didn't know it. And I really didn't discover that sports medicine was an option for pediatricians until long after residency. And somebody who did sports medicine and was a pediatrician came to our hospital, and it was almost like a, an aha thing. I said, this is what I want to do. And that changed everything. And then I started going to the meetings, meeting all the people. I got to meet Rosemary during my fellowship, which was wonderful and always inspiring.
Yeah, I think I'd echo a lot of what Drs. Franck and Coleman said. I think I was always interested in, and played a lot of sports. I think to call me an athlete would be generous, but I did play a lot of sports growing up. And when I got to medical school, I had the opportunity. I thought I would be interested in sports medicine for a number of reasons, maybe some of the things mentioned, maybe some other things, but I had an opportunity to do research with it. And I didn't mention my primary specialty, apologies to Cleo. I'm internal medicine, but the reason I chose what I did was I did research between my first and second year of medical school with the PM&R physician who was doing research in risk factors for stress fractures in female military recruits. And she's the one who kind of said, if you're, the choice is sort of between surgery and sports medicine being kind of a more holistic approach to looking at athletes and surgery being surgery. And I think I just gravitated towards sort of what we do. And I'm forever indebted to that person that I did research with.
Thank you, guys. So the next question is going to be directed towards Dr. Stafford and Dr. Whitley. And it's what other factors influenced you going into sports medicine?
I mean, in addition to what my colleagues already have said, to me, I played baseball growing up, and I grew up as a middle class kid, but a lot of my friends and teammates, they came from lower socioeconomic class in Miami, Florida. And so if I ever got injured, my parents were able to take me to the doctor, and I was always able to get back to the field. But I know some of my teammates didn't have that same opportunity. And at the time, I didn't really understand what was going on. I didn't really understand health systems as a whole or insurance until like I started playing against some kids from higher socioeconomic status and tournaments. And then I started to notice the disparities. And that's why I truly understand what health disparities really came back, even from a sports medicine perspective. And for me, when I got into sports medicine, I definitely wanted to eliminate them because there's so many kids who have opportunity to use their gifts in so many different areas. However, it was cut short because they didn't have access to healthcare.
Yeah, I would echo a lot of what everyone has already said, right? So sports has always been an important part of my life, my family's life, being active. But I was not the kid who from day one thought he wanted to be a doctor. I ran from it. I had interest outside of medicine, but as an athlete in high school, did have a couple of injuries that really was what kind of opened the doors for me and kind of changed my perspective on things. And I came to a realization that if I could do what those docs did for me, and be on the sideline, be a mentor, be an advocate, that it'd be a career worth having. But like I said, it was not a singular aha moment. There were multiple kind of checkpoints along the way where things were reinforced to me that this is something that I wanted to do, and I thought it had value and meaning and purpose. And that's been the case throughout my career thus far.
So for Doctors Coleman and Whitley and Dr. Rosario-Concepcion, the question is, why did you choose your primary specialty? And I know that maybe we can start with Dr. Coleman because you probably picked it without sports medicine in mind at the time.
I did. I've always liked pediatrics. I've always wanted to be a pediatrician. They say the mark of a pediatrician is when you go anywhere, you know where all the kids are, and I do. And you talk to the kids, just like people who are dog people. They're in the park, they talk to the dog, and then they talk to the owner. Well, I talk to all the kids, and then the parents. I notice them everywhere. It's just so fun. All the ages, even as they get older and they can be a little bit more difficult to interact with. They're all just beautiful people. So it's great to see them. So I've always enjoyed that. I never wanted to do anything else. People told me I would change my mind all throughout medical school, and I never did. I enjoyed my other rotations, but peds was still the one that, at the end of the day, I wasn't counting the hours. I was happy to still be there. Even if we'd been there a long time. So peds is for me.
My story is a little different. I came in, maybe like a lot of you, thinking that the way to sports medicine was through orthopedic surgery. Surgery was my first rotation. I hated it. I was miserable. I was like, this is not for me. Standing in one place for hours and hours on end, looking over tiny instruments, it just didn't jive with my personality. But the one piece I did like with the surgical rotation was our trauma nights and being in the ER and the pace and moving from one thing to the next and using different skill sets, different parts of my brain. And it's really kind of what drew me to emergency medicine. I always knew I wanted to eventually find my way to sports. But I was focused on being a good EM doc first, right? I always wanted to feel like I had value no matter where I was in the world, whether I was in the farthest corners of the globe at 30,000 feet in the air. I wanted to feel like I could be of service and of help. And that's part of why I still do ER shifts now. And it served me well being able to kind of have a hybrid practice. And so I couldn't be more fulfilled.
So my story started probably earlier than most. During high school, I had no idea what I wanted to do. So I literally went to the career day to see what I like in that day. And I went to see this sports medicine doctor in my 11th grade, talking about what he does and how he takes care of athletes and how rewarding it was. And apparently, according to my mom, I arrived home saying that I want to be a sports doctor. So I decided to do medicine to be a sports doctor. So that's always has been my goal. In terms of answering why I selected PM&R, is because growing up in Puerto Rico, actually PM&R are the sports doctor. And it's very common that they have prior practice down here. So everybody kind of in the island, when they get injured and they have an ankle sprain, they go first to the PM&R doctor in their MSK clinic. So for me, sports medicine was PM&R. That was my first introduction to PM&R, was actually just sports medicine. So later on is when I kind of learned that actually PM&R is a bigger specialty that encompasses kind of other different fields. And that's where I started investigating a little bit more. And during med school, then I kind of learned that it can go through family medicine and ER and all these other things. I started considering those options, which I liked probably most of them, and that make it difficult. But at the end of the day, kind of I drove back to the PM&R kind of background of functionality and independence and kind of all those things, understanding that initially I wanted to stay in the island and kind of practice down there. And that's kind of the traditional way of being a sports doctor there. So that's kind of how I decided. Interesting enough, the doctor that was in the career day, he became my mentor and the program director and the chairman of my program in Puerto Rico, which is Dr. Michelle. So he basically was the person that kind of enlightened me and gave me like the lights of being a sports doctor.
So it sounds like the consensus is go with a specialty a primary specialty that you're drawn to, and sports medicine can fit with that. It seems like you guys have very diverse primary specialties. So for the next question, this is for doctors Dixit and Burton. And the question is, what does your patient sample look like?
Okay, I'll start. So my patient day is full of anyone up to 21, like I mentioned before. So in my practice, I'm only seeing sports medicine. And so there's different ways that you could choose to structure your practice. And some people, because we are primary care providers, may do a little bit of their primary care specialty. And some may do just the sports medicine or kind of orthopedic side of that. And so my practice is all sports medicine at Seattle Children's. We only have one community clinic, as I mentioned. And so when I first started, I actually had the desire to do both general pediatrics and sports medicine. And that wasn't really an option of the way things were structured. And interestingly enough, like during COVID, I got to go back to my roots a little bit and do a little bit of pediatrics because there wasn't any sports going on. So it also helped me learn that I really enjoy doing my sports medicine and going to kind of stick with that. So, but my general population from day to day looks like mostly I would say my patients are from about elementary age through high school. Sometimes people come back, I feel like, for that first year when they go off to college, but then they tend to not come back because they're either like linked with this college that has support, or they feel like they're too old. So in my population, I would say that I see active kids. So patients that are doing sports, doing things like dance or parkour or other physical activities and have injuries, and work with them to go see what's going on and then help them to get back to their activity through referrals to physical therapy and other recommendations and evaluations. And then I'm just going to throw this in here because I also have patients that are like maybe the opposite. And so about 2 years, I guess, is now, I started a movement clinic. And in that clinic, I really feel like, as somebody who's a sports medicine trained person, that I have a passion for that everybody should have the opportunity to be able to move and be active. And there's barriers that exist for people to not be able to be as active as they may like to be. And so I found it really interesting to look into, like, what are those barriers and how do we support people who maybe don't have the access or have become inactive to become more active. And so another side of my practice is a movement clinic where we try to come up with ways to be active and address those barriers, and so that everyone can enjoy the benefits of physical activity.
That sounds great. You know, my clinic right now is primarily, like I said, non-surgical orthopedics. I work with active people from adolescence to literally, I mean, today I had a 75-year-old marathoner. I think, but over the course of my career, I've worked in primary care settings. I've done a lot of primary care for athletes in team physician roles, and even in the collegiate setting, where I think you get a lot of sort of exposure to primary care and the things that come up in that age group. So I kind of get to use my internal medicine hat, which I enjoy doing. So I've had a lot of fun with that.
And for Doctors Stafford and Franck, the question is, what is something you would tell your younger self?
Patience, number one. Rome wasn't built in a day, and neither will you. Two, give yourself some grace. I feel like a lot of times as we go into medicine, we can become very hypercritical of ourselves because we try to hold ourselves to some standards that are likely unattainable, myself included, and that's what really drives me. But I think allow myself to have my patience and allow myself to see the journey through. The younger version of myself will be worried about the next step. What's the next test I have to take? What residency I'm going to apply to? What's going to happen when I finish residency, as opposed to just enjoying a journey and what's going on in my day-to-day activities, because that's what it's really all about. So if I had a chance to tell my younger self, just enjoy the time that you have while you're going through the process.
Yeah, and I have to agree with Cleo. He took probably both of those out off of what I would say, because just having patience and grace for yourself will say a lot, because sometimes as you go through training in school, you feel like you're behind when you're exactly where you're supposed to be. And to all the medical students, residents, you know, do your job, you know, put in the time and things will come. And just make sure you do things the right way. Take everything in and just kind of take in the studies and learn everything, and your patients will thank you for it in the long run. So that's what I would say, because getting to this end, if you would have told me that when I was, maybe in high school, like, hey, you're going to get exactly what you want to be, but take some time, make sure as you're going to the grind and enjoy your family. Study hard, make it worth it when you are studying, but enjoy some of the other stuff in life that helps you be a person and help you kind of connect with the outside world, outside the medicine, which is your family, your friends. We all probably on this chat have missed important events for our friends, going through school, and just saying that it's okay, but if you can make it, try and make it. You can make up for the one chapter or the one PowerPoint down the road, but take in life, because there are certain things in life down the road that you probably can't get back. But enjoy life as you go through it.
I would like to add something else. I know we have probably a lot of medical students, so the first thing that I probably will tell myself is that it was worth it. All the years of learning, I really enjoy what I do, and I'm glad that I doing this job. So one of the first things that I tell medical students when they ask me if they want to that they want to be medicine or sports medicine, just try to make sure that you enjoy what you do, and because everything else will fall into place if you really like helping patients and helping athletes and all those things. So I definitely really enjoy, and that's something that I would tell myself.
Sorry, and I don't mean to belabor the point, but I think what Raul said is really important. And I'll often tell students, residents I'm mentoring, that figure out what drives you as a person, what makes you, what makes you tick. Chances are those things have been the same since you were a kid, right? Like if you like to travel, you probably like traveling as a kid. If you liked competing, you probably liked it as a kid. And so figure out who you are. Take the time now in the midst of your studies, in the midst of preparing for exams, to just figure out, man, who am I, right? And then I promise you, it makes figuring out your career so much easier. And then you get to a point where you are happy, you are satisfied, you are fulfilled because you've done the work internally and figuring out what makes me me. And then you kind of reverse engineer it into, this is my job.
Yeah, thank you guys. That was good to hear, especially as a med student going through it now. So the last question before we get to the Q&A is for Dr. Burton, but if any panelists want to jump in and add anything, feel free. But the question is, why do you think it is important to have diverse representation in sports medicine?
So I think some of this has already come up from what our panelists have shared, but I would say that for myself, that when I was growing up, similar to many people's stories, I didn't really have anybody who I didn't even really have a sports medicine doctor until I was in high school, because it was just newer. I think I'm old enough that like there were less sports medicine doctors or providers of any sort. And so I think that like that was one point that kind of made me realize of like, gosh, like what is this and how can I do this? And choosing a specialty like pediatrics, where like Nailah was mentioning, like I actually was told that I couldn't do that when I was in medical school, and really felt drawn towards pediatrics, always the one saying hi, waving to the kid and smiling also, but really wanted to do sports medicine as well. And I think that as I went through, having been an athlete and having been then going through medical school and residency, I just didn't see that many people in the world of sports medicine that looked like myself. And I realized that like as a young athlete growing up, to, for one, find a sports medicine doctor, but then also to think of finding somebody who looked like me, I think that the things that I would have taken away from myself was like, I can do that. I can be that person because I see somebody who looks like me. And so I think in that way, now I will hear it sometimes from my own patients that it was actually very interesting during COVID in particular, when I was doing primary care again. I had people who came to see me literally just because of what I looked like, because that's what they wanted for their child. And to see that people who looked like them would go into medicine. And I was a little taken aback, especially since, like I said, I was filling in for primary care and pediatrics again. I was like, well, I don't know if you really are going to be happy you chose me to do this thing I haven't done for a while, but I realized how significant it was. And I would say almost every single day that happened to me. So I think it also like struck me on the other end of being a provider of like how important it is to have people that look like you when you're caring for athletes. I guess I would also just say that there's many examples that I can give where there's when you're in a situation, when you're working with athletes, and there's just some type of like connection that you have when you are around people who you can identify with, whether it's because of what they look like, whether it's because of gender, whether it's because of like a disability or whatever it may be. I think that we know that just in life that we are able to, when we find commonality between people, it allows us sometimes to just have that initial like barrier that's broken to be able to find connection. And in the world of medicine, where you're working with people and you're trying your best to uncover things, you're trying your best to be able to find what's going to speak to each person to be able to help them as best possible. It's so important that you're able to have some of those, I guess, like just barriers broken down to be able to have that connection. I find that people are able to open and they're able to share, that they're able to have some insight maybe onto their experience. So for me, it's really important that we continue to build that pathway for young people into medicine by mentorship and support so that we continue to grow the different types of providers that there are out there, so that all of our patients and our families, our young athletes, are not young athletes, can find people that they feel like they can relate to, so that they can hopefully have that trust and that connection to be able to enhance the care that they get from already, obviously, all this hard work that people put in, but just to be able to build upon that relationship, I think allows for an even more expansive result in your connection and your care. And I'm sure everybody has lots to share too. Obviously, a passion of mine to be able to find a way to motivate and to mentor and to support people to come into healthcare, and in particular sports medicine. And really happy to see there's even some faces on here that I was like smiling because I see on here, in particular, someone that I'm not going to call them out, but just makes me smile to know that they're going into healthcare from knowing them since they were a little one. So.
I would echo a lot what Dr. Burton said. One particular story that comes to me is when I was a fellow. We had to go do physicals at a historically black college university, HBCU. So I went to FAMU for undergrad. So of course there was HBCUs are very close to my heart. So we go down to go do these physicals, and I'm with my other co-fellows, and I see a particular young man. He doesn't know me from anyone else, and we go to give a handshake, and everyone else is amazed that we both know the same handshake. And from that point on, the athletes just really opened up to me. And the rest of the fellows was like, well, how did you know that, he was going to do a particular handshake? I was like, well, this is something that we just kind of do growing up. And the athletes from that point became a lot more open with us because they just didn't see us as physicians anymore. They saw us as people who actually cared about them. To kind of get back to the question is that when you see someone that you can identify with, either it's race, color, or even activities. I have a lot of folks that come see me because they're overhead or throwing athletes. The fact we have someone kind of interest that you can relate to, that you feel like you can come have a conversation with, that just doesn't see you as another 20-minute appointment, but as a person that's invested in making sure you continue to grow and continue to improve whatever situation you're in. I think it's a very important part of why representation is important.
And to add a little bit, I think also the language kind of helped me being from Puerto Rico and speaking Spanish. I think that has helped me to connect with a different population, a Hispanic population here in Florida, that when you see a patient that is struggling with the English and then you just start talking Spanish and they're like, I thank God that you speak Spanish so I can explain a little bit better what's going on. So that kind of increased a little bit of the rapport, maybe in that population, that having that diversity, that maybe I can help with those patients and other provider or physician can help with another kind of patient. So they feel very comfortable with. I think that can be very important also to establish that connection with patients.
Yeah, thank you. Thank you, three. Now I guess we'll jump to the chat because we have so many people with great questions, and a lot of you guys have gotten to them in the chat already, but some of them we haven't. So the first one is a medical student, Jada Ashford, and she was asking, and we kind of addressed this already, so if anyone wants to add to what was already addressed, how do you incorporate underserved communities in your practice?
I could respond to that. I mean, I think it's choosing where you work a lot of times. I mean, maybe this is an easier question for me to answer from the perspective, like I work at Seattle Children's Odessa Brown Clinic, and that's the patient population that the clinic serves. But I will say that initially, like when I first started working, that I kind of took the opportunity, allowed me growth and to learn a lot from my colleagues. I was at University of Washington, had some really amazing colleagues that helped mentor me through my early part of my career. And then I really wanted to focus more on like pediatric sports medicine. And so went to Seattle Children's, and Seattle Children's is a hospital that serves everyone. And so, and I think that what I really felt that I always felt when I was growing up, and that I think was drawn to and kind of continued to look for, was to be able to work in a population that was underserved. Actually, I grew up in Seattle, and the Odessa Brown Clinic was right down a couple blocks away from the high school that I went to. And I remember saying before that I always wanted to come back and work in my community. And when the opportunity came to be able to be in the community again, I really just jumped on that and worked really hard that to get there. So I think that sometimes it may be a matter of sometimes there's opportunities when you're coming out of training that match for you, because that's going to help you to build and to grow. And it may or may not be in your permanent ideal situation. I think that often is true, that you don't necessarily start your first job where you plan to be forever. And then as you learn more about what's really important to you, and if you kind of already know that that's an area that's important, you start to look for the opportunities in the community. There's often lots of opportunities in the world of sports medicine where you can, serve as a volunteer physician for a high school, be a volunteer physician for events, be on community boards and things like that. And then, building your way into a practice, if you're not already there, that serves an underserved population. And sometimes it may actually also be speaking up about what your subspecialty of sports medicine is. And if there's an area that you really want to practice and they don't have a provider that type like that there, then advocating for yourself and what you can do for the community. So I think there's lots of ways, either through your practice or through volunteer opportunities, to build it to be what you want it to be.
Hey, so one of the ways that I got involved was I actually was able to get the opportunity to move back to my hometown. And being there, I was able to know what opportunities there were. I started volunteering at my alma mater, which is an inner city high school here. And from that, just learning the community and seeing what they need and trying to fill the gap, whether it was a fitness day to educate the masses, or doing walk with a doc, or just doing a free physical for a inner city community where most of the parents work, and it's a struggle to kind of get them the kids involved and get physicals. So I started working with my health system and trying to coordinate free physicals for this inner city community, and it's something that we do, and just being involved. So it's really different for everybody, and you really have to just learn the community that you're going to serve and how you can plug into that community and see what they need and provide them. Because the worst thing you can do is try to give back to something, to a community that they won't be receptive. So first thing you need to do is learn that community, learn the people, see what their needs are, and you can help in so many different ways, whether it be shop docs where we do barbershop talks, community fairs, or whatever. So you can choose to be involved however you want to be involved.
I think the common thread in what everybody's saying is to be intentional, right? If it matters to you, then you'll act in a way as if it matters to you. And there are boundless opportunities to be involved, to make a difference, to find out just what speaks to you and do it that way. But me, for example, I have worked with some of the schools on the south side of Atlanta that don't traditionally get the same sort of coverage as those in the more affluent northern suburbs, right? And so your presence speaks volumes, right? And you're a role model. You are at once an older brother, right, as well as a father figure for some of these kids. As just being there and being open to their conversation and questioning, just being someone that they could see and tangibly touch makes a difference. But for me specifically, sometimes it's in the ER, right? I'll see patients. I work in a busy inner city ER. A lot of these patients are underinsured or uninsured, and I'll scoop up the ortho complaints when I see them, knowing that they may not be able to be seen in clinic, but I can at least guide them through, hey, this is what's going on. This is what would happen if you went to see an orthopedist in clinic. I know you may not be able to, but here's a home exercise program to help you with that problem when this injury. And so if you're intentional about it, you can really make more of an impact than you ever would have imagined.
Okay. Sarah Mazangi asked a really good question. She asked, as minority woman, what have been some barriers that you faced and how did you overcome them? And what advice would you give to other minority women who want to go into sports medicine?
I will say, I had a lovely introduction to sports medicine. I will say I never had a Black teacher. I never had a Black doctor. So I never really saw anybody who looked like me doing what I do ever until I actually started doing it myself. So it was just something that I fortunately discovered when I was finished with residency and just kind of started working that. I'm sure that I had instances where things happened that maybe didn't happen to a male provider or a white provider, but somehow I just kind of pushed past that, and I know I had support throughout the time too, because there were lots of people who helped me. As I mentioned, Rosemary was one of those. I think the thing to think about when you're thinking about barriers, well, I guess if you don't see it, it's hard to say if it's a barrier because you'll continue on. So I would have that be your plan. So if you have a goal that you really want to achieve and someone says, well, you can't do it that way, then say, fine, how can I do it? I'm going to do it some other way. And so if that happened to me, if there were people who put roadblocks up for me, I was like, fine, I will do it a different way. And I will say in pediatrics, we don't get a lot of exposure to sports medicine. I know that's been a thing in the chat. What's the fastest, easiest way to get to sports medicine? It's not peds. And I had very little exposure, like I said, and I applied after I discovered sports medicine was for me, and I didn't get it. I just, got a lot of rejections. I applied to like 20 programs. I think I got 2 interviews. And those 2 interviews gave me great advice, and I took it. And they said, get involved. So shadow somebody who does sports. Go to games and see if you can cover those, or at least stay on the sideline. Go to the meetings. Try and get involved in someone's research. I did all of that. And that next year I applied. I took I think the same 20 places. I got 3 interviews, so 1 more. But I got my fellowship then. So I think I was, as Dr. Whitley said, intentional. Because I now knew what to do. So I would just say, if you've got a goal and you discover that you're not able to get to it the way you had initially planned or thought you would, then find another way to go around that barrier and still get to that goal if you find it worthy, a worthy goal for you.
Yeah, as the other, I think, minority woman, I'm going to speak up. I would echo everything that Nailah said, and I had a very similar experience, like as in peds, initially like applied and just, I can't remember, I actually really followed through with my application because it was just like kind of laughable. Like I didn't have any experience because it just was not part of our training in our residency. And then I like just kind of wrote an email and reached out to a woman who was a physician at Cal at the time and said, hey, would you be interested in let me shadow you after I'm done with my residency? And at first she said no. And then she wrote me back and said, yes, I will. And I actually had no idea how amazing this woman was. It was Cindy Chang, who who's, for all the people who know her, is really remarkable. And I feel like I just got lucky in reaching out to this amazing mentor, but she really mentored me and she supported me. And I think I realized how important she was when I was on like my interviews and everybody was like, Dr. Chang wrote you a letter. And I was like, oh, this is actually really important. But she never let on how important she was. And she was such a great mentor. So I think that like what I would say is like, being intentional and persistent about seeking out mentors, because all these people here are here to bring more people into sports medicine, and we're all here to support you. We want to find ways to be able to provide you support, advice, any type of mentorship and connections. And Sarah, I know you know somebody who would be really happy to support you. And so I think like never be shy of reaching out to people, because that's definitely for me, like I felt like, oh, I don't want to like bug anybody, and like we get a lot of emails, so you know, if we don't answer once, message us again. If you're really not getting a response from somebody, then reach out to somebody else. But it's amazing how like one connection may provide you a connection with a lot of other people, and the advice and just conversations, being in the room of places, coming to meetings, is a really great way to be involved. And like I said, happy to always mentor and be here.
So another question, this would be good for Dr. Franck and Dr. Rosario-Concepcion. The question is from Jada Ashford. She said, for someone deciding between PM&R and family medicine, what are things that you should look at when picking a primary specialty?
I feel, and my personal perspective is that you need to love your primary specialty. So after that, everything kind of fall into place. So you need to kind of look first which of those two specialty kind of gives you more happiness or more desire to kind of help patients, which technically they're two different specialty, and you see different kind of patients and the goals are different. So I think that would be the goal of determining if you want to be like a more of a primary care physician or a rehabilitation kind of functional physician. And then after that, then you make the decision in terms of what specialty you want. Because at the end of the day, like everybody is saying, you have to look for the opportunities. And if you're here, it's because you're looking for opportunities. So you have to look for the mentors, even though you might have difficulty in some specialty because it's not a traditional route. It's your job to find those mentors and those opportunities, because if it's what you want to do, you need to put the effort in terms of looking for that. So at the end of the day, I will say, try to see which specialty kind of correlates better with the way that you practice medicine, and then start with that and go from there.
And I would agree as well. The facts that I would put forward is that, so to get into sports medicine, there's four different specialties you can do: family medicine, internal medicine, PM&R, pediatrics, and ER. I named 5, so don't mind my counting. Most family medicine most, let me take it back. Most sports medicine fellowships reside in family medicine fellowships, but the vast majority take every single specialty but there are a good amount that only take family medicine. But the fact that what Dr. Rosario pointed out is you need to think past that. You need to actually know that if you don't make it into fellowship, you need to be happy with your specialty. You need to build off that specialty to bring it into your sports medicine practice, because we have a vast amount of physicians who actually practice only sports medicine here, which is very kind of unique and relatively new, because sports medicine is actually a relatively new specialty, period. So a lot of sports medicine providers overall actually still practice their primary specialty at least 50% of the time, and then they do sports medicine the other whatever percent is left. So I would say do the specialty that provides you the most interest and something you can see yourself doing for the long run, even if you choose to do strictly ortho sports medicine after that. But if you were required to do that specialty, you still could, and you wouldn't be miserable. I don't think any of those specialties you would be miserable in, but to each his own. PM&R is great, internal is great, pediatrics is great, ER is great, and family is great. And none of us probably would change any of that from the world. But just be happy in doing 3 years in that specialty, 3 to 4 years in that specialty. And that's what it's really about, because if you're happy in that specialty, you'll be even more happier in sports. But if you're miserable in the first 3 years, then you aren't going to be happy doing sports, because a lot of the stuff you do within sports are going to revert back to your primary specialty. So make sure you make a choice based on where your interests lie and where you can see you doing for the rest of your career. So that's why what my advice be. But family is bomb.
I would also say, when you're in residency, be in residency. Where I see residents get in trouble, particularly in EM, right? That this is probably the least traveled path to sports medicine, and they find me. It's really apparent, and it's a small community, but it's really apparent when someone is not focused on what they're supposed to be doing when they're supposed to be doing it. And it always comes back to bite you. So focus on doing what you're supposed to do while you're doing it, knowing what you're working towards, being strategic about that. You know, EM, for example, there's, as people have said, the majority of programs are based out of family medicine, or there's some sort of PM&R track through it. EM, you kind of have to figure that out on your own, right? There's maybe 12 or 13 EM based sports fellowships. Then you have those that will take EM residents, right? And then you have those that say they take them, but they've never taken one, right? So you have to be able to kind of read between the lines and know where you're going to be supported, what is the infrastructure in place. But again, these are secondary thoughts and conversations. If you're an intern, be an intern, and work on being the best intern you can be, hone that skill set, because the reality is, even if you go out and you practice pure kind of non-operative orthopedics, the opportunities in sports, they're going to revert back to your primary specialty at some point. And that is what is going to make you stand out. That is what is going to open opportunities. And that's really what's going to allow you to take the best care of the athlete.
Dr. Whitley, following up on that, I actually had a question for you. If you're applying to programs and like EM, for instance, where like sports medicine might not be a track that's built in your residency program, I don't know if you had a fellowship program for sports med there, but like, how did you create those opportunities for yourself for like game coverage or like getting involved in sports during residency?
Yeah, no, that's a good question. So I was fortunate, and my path is not the most unique. So I came to Emory from med school, and then stayed for EM residency. But during my last year of med school, I did a sports elective, and so I got to know quite a number of faculty members, and our personalities vibed, and just kind of kept those contacts open throughout residency. I think the biggest thing with any of this is you have to figure out how to articulate your value, right? And whereas the PM&R residents, they come in and they have a mini curriculum within sports medicine, EM, you don't have that, you know, and the family medicine residents, they could almost have a mini fellowship as part of their residency where they get assigned a team to take care of. EM, if I told my chief residents that I needed every Friday night off from August to December to cover high school football, and they would laugh at me. That's just not how EM works. And so sometimes it does mean biting the bullet and saying, hey, I'm going to help with spot coverage here or mass physicals, which no attending wants to do, right? If the resident comes and helps, it's a big help and it stands out. So I would seek out those sorts of things. But then, again, just really try to articulate, hey, this is why me being different can be helpful, right? I am comfortable when stuff goes left. And I've been fortunate throughout my career that people have recognized that. You know, I think what happened with DeMar Hamlin last year, they gave people like me a little bit more kind of say, hey, this is why we have a place. But it is challenging. You just have to be intentional about it, network when you can. And then, like I was alluding to before, trying to figure out, is someone actually interested in kind of diversifying their sports medicine practice as a whole, or is it lip service?
Thank you. There's actually a follow-up question from Caitlin, and I want to respect everyone's time as well, so this might be the last question. But she says, as a third-year medical student interested in both EM and sports med, when applying to residencies, how do I voice a commitment to both interests? Should I mention my interest in a sports fellowship, given that EM seems to be the path less traveled?
Give me a second. I'm just reading it myself to make sure I understand the question the right way. Yeah. So I would just be upfront with people, right? You said, hey, you know, because a lot of times you interview, they'll ask you, no matter what you're going into, hey, what do you see yourself doing? You know, why are you applying to this program? What interests you? What draws you? And just be honest about that. And so when I applied to residency, I selected programs that either had, you know, a sports fellowship kind of linked with it, or had prior resident graduates who went into fellowship. And so I was upfront with people about it. But again, once it was time to be an EM doctor, that's where my focus was.
Okay, thank you. That's helpful. I know you just got a lot of questions interrogated. But now for like all of the panelists, if anyone has any closing remarks or any like pearls that they want to share, feel free to unmute.
I guess I would just say that, like, you know, joining AMSSM as whatever level of training you are is a really great place to meet people and look for opportunities for mentorship. There's mentorship programs, so definitely do that. I think all of us are here because we're invested in bringing more people into sports medicine, and so you can definitely reach out to us, and we would love to support you. And yeah, I guess that's all. I think it's great to see so many people on tonight, and looking forward to probably more people viewing in the future. And we are here to support you and really excited about what the future may bring in sports medicine.
I think I'll just add, don't be upset about a detour. When I finished residency, I actually didn't know what I wanted to do actually for my life. I knew I wanted to be a pediatrician. That was like a lifetime goal. And then there I was, I finished residency. I'm a pediatrician. Now what? And I didn't know. And so I actually wound up working in our IT department at our hospital. We were converting from paper to a computer system. And they wanted residents, who usually are the ones who do orders in the computer system, to be involved in that process. And so for 4 years, actually, I worked in IT. And I actually now, just a few months ago, I got my clinical informatics board certification related to having done all that work way back when. But it was a great detour, and it was something that I learned. It's something that's helped me now. So don't be afraid of a no, or do it this way or change around or something like that, because that'd be something that just makes you a different but better candidate moving forward. So enjoy the process no matter what happens at the moment.
I just want to say thank you everyone for coming tonight. Thank you to all the panelists. The last thing I'll add is don't be afraid of failure. The only way we're going to continue to push forward is that we can't be worried about the negative consequences. We have to worry about the positive that we could potentially bring. You know, being a physician, I still believe is a calling, despite everything else that might be going on. There are going to be good days. There are also going to be bad days as well. But I think us as community banding together continues to push us forward. I think it's going to continue to allow us to do this for the next 50 to 100 years or however long I'm alive.
I want to build on that and say you guys, thank you for joining us. Thank you for everybody on the panel who decided to give their time. I also want to point out to everyone that the reason that these people were on the panel is because we want to help and we're open to mentoring. Monique wants all the emails, but no, we're all here and we're all available. So reach out to us, whether it be email, social media. At the conference, we're all going to be at the conference, and we are trying to put some after the conference type social get together that will pass some information out later. But come out, talk to us in person, and just come figure out what you want. Answer these questions in person. Everybody's different. So just go for it and find and be active in finding a mentor and the answers that you want, because we're all here for it.
Yeah, thank you, Dr. Franck, for reminding everyone of the conference. The pre-registration closes tomorrow, just in case you haven't registered yet. And the other thing is the panelists have been so generous to offer to mentor everyone. There is also a program through the AMSSM for students where you get paired with an attending or a fellow mentor. So if you go onto the website, you can find that just so that they don't get bombarded with emails too. But yeah, otherwise, thank you guys so much for sharing your experiences today to the panelists, and thank you to the students and the residents for coming. This chat room will be open after, for a few minutes afterwards if people want to stay on. Otherwise, yeah, thank you for coming and have a good night.